Good morning, Year 10, and welcome to Lesson 4 of History. So today we are going to look at the creation of the National Health Service. So last week we looked at the build up to it, we looked at Bevan, we looked at the Beveridge report. And now we're going to start to look at the implementation of the National Health Service, and then also next week we're going to finish by looking at sort of evaluating the impact of it up until today, which at the moment is very relevant. So today we're going to look at the benefits of the NHS and some of the opposition that it faced when it was created, and we're going to start to evaluate the impact of the NHS, but we're going to finish doing that next week when we look at how it developed through the 21st century. So first of all, let's have a look at some figures. So I've got this table which shows the average life expectancy for the UK throughout history. The figures don't mean that people died at that age, it's just obviously an average. And up into the Victorian times it was reduced by the fact that so many children died, and if you could survive into adulthood then actually stood a good chance of living into your late 50s or 60s. And remember, as late as 1861, 57% of children were dying before the age of 5. So if you look at these figures, I've gone from medieval all the way through to 2015. What do these figures tell us about the health of the British people throughout history? What factors, we've looked at different factors and we've looked at lots of things up until now. What factors do you think have improved people's life expectancy over time? So try and think of as many as possible. So for example, today we're looking at the government and the government implementing and putting in reform. So one factor could be the government, but what other things do you think will have helped life expectancy? How have we gone from a life expectancy average for a man of 35 through to 79? And then if you want to challenge yourself, what kind of problems are caused by people living longer? We have what's known as an ageing population. So geography, my sister's a big geography nerd, and geography tends to talk about things like an ageing population. So what problems do you think are being caused by people living longer? So have a go at those, pause the video and have a go at answering those questions in your book or on your piece of paper. So what was the healthcare like before 1948? Because we've looked at this quite a bit. We've looked at how the Liberals started to introduce their reforms. We've looked at the Beveridge report and the improvement of housing throughout the First and Second World War for Homes Fit for Heroes. But I want you to have a look at the clip. The clip should be at the bottom on the link of this video, and it will take you to YouTube and a clip called The Spirit of 1945, and it's about health, and it's about 3 or 4 minutes long, and it's just got some people that are talking about what they remember when the National Health Service was introduced, but also why some people were a little bit reluctant, and also a little bit about what people were facing before, what healthcare was like before the NHS was introduced in 48. So just have a watch and just make a few notes, just to recap and remind you what healthcare was like before the introduction of the NHS. If you've got any problems with that, contact me on Teams if you need to. So just a reminder from last week, we looked at the Liberal reforms in 1906 to 14 the week before. By the 1940s, a lot of people are still not particularly healthy. We've also gone through 2 world wars in this time as well. So 42, William Beveridge did his Beveridge report, and if you remember, there was the 5 big giants that he needed to slay. We've got want, disease, ignorance, squalor and idleness. And after the war, when Clement Attlee became Prime Minister in 1945, he agreed to implement these proposals and create what we call the welfare state. Okay, and the welfare state encompasses everyone, and it's all about how the government is helping provide things for other people. And a part of this creation was the National Health Service, and Aneurin Bevan was the main guy who was in charge of implementing that. And if you remember, Aneurin Bevan had a few issues because some people wanted this whole NHS that had been suggested by William Beveridge, but Bevan had to be the one to implement it. He had to convince the government, he had to convince his opposition that this was the best thing for everyone for it to be passed and to be accepted. And for the first time, hospitals, doctors, nurses, pharmacists, opticians, dentists were all brought together in one organisation to provide services that were free to all users. And the health services were to be paid for by taxes and national insurance. And the aim was to provide support from cradle to grave. And there was a lot of demand for the free NHS that it actually couldn't continue, and charges were started to be implemented after 1952. Most services remain free of charge, but even today, for example, once you're over 18, once you're working, you start to have to pay for things like your prescription or your dentist appointments, but on the whole, we are still benefiting largely from free healthcare throughout. So July 1948 is when we start to see the NHS become created, and this was a really, really big moment for a lot of people because it was introduced. Everyone could now have free healthcare access, and up until this point, up until 1948, it's estimated that around 8 million people had never seen a doctor before this time because they couldn't afford it. And so, you know, this was a huge moment for them to be able to come to the doctors and go to hospital and actually see a doctor and receive some healthcare, because they'd avoided it up until this point because they just simply couldn't afford to do it because food or their home was more important. And obviously the NHS has been more important than ever in the last couple of months. So when we think about the significance of the NHS next week, we've got an awful lot to take in and an awful lot to evaluate. So I made it look quite pretty with a nice little heart. But these are the services that were provided by the NHS after 1948. So when it was implemented, these are the things that started to come about, which obviously was very exciting for everyone. So we've got healthcare centres being set up, we've got hospital doctors being paid by the government, and they were also still allowed to treat private patients. Obviously, doctors were making an awful lot of money before the NHS because they could pay what they wanted, and that was one of their big worries, and we'll look at opposition in a moment. So they were kind of pacified by Bevan to ensure that they would be on board, and they were allowed to still treat their private patients. And we still have doctors today that do both private and public healthcare. The NHS was funded medical research, so funding medical research meant that more things were discovered. They could start to look at different diseases, they could experiment with operations, medication, and obviously we need all that funding still and research today. We have lots of research going on. It's now sort of in lots of different universities and stuff, but you know, the NHS funded that and was sort of got the ball rolling, shall we say. The NHS also provided maternity care, so maternity care was a big thing now. If you've ever watched Call the Midwife, which is very good, and it's on Netflix and BBC, you should watch it, and you watch Call the Midwife, you can see how maternity care has changed throughout the 21st century, 20th and 21st century, and how it has developed. We've got child welfare services to make sure that children are being looked after and their healthcare is being considered as very important. We've got ambulances, okay, so if there's an accident and you need to go to hospital, and you obviously driving in buses and were, you know, very short supply then, there was more transport. Vaccination programmes were organised and funded through the NHS. Remember, we started with Edward Jenner and his vaccination, and now it's becoming more main scale. We've got free dentistry, spectacles and medicines being provided. It's a big rush for people to go to the dentist and opticians when the NHS opened up, because they were like, I can see, I can get glasses for free, it's exciting. We've got the NHS spending lots of money on training specialist staff. We've got family doctors working for the NHS, and we've got the government taking control of all the hospitals, rebuilding them and making sure that their facilities are improved. So what I'd like to do is just pause, and can you copy out this mind map in your book so you've got notes of exactly all of the services that were provided for by the NHS. So I've just got this source here. This is from an interview from someone who was speaking in 2004, and they were remembering sort of the impacts of the NHS, and he put, "We were sorry to see Churchill voted out. He was our war leader, but he never promised to give the new ideas a go. The Labour Party did, you see, and they publicised this in all the newspapers. Servicemen like me expected so much after the war, perhaps utopia, and the welfare state seemed to be a good start. I didn't mind paying a bit more of my salary to know that a doctor or a dentist was there if I needed them. I felt it was worth it, that the government cared about us a bit more, I suppose. I think there was a bit of a rush when the NHS first started. There were stories of people going and getting whole new sets of teeth, new glasses, even wigs. Perhaps they'd have struggled on before with their short-sightedness or their painful teeth, but now they didn't have to. So pause this, have another read through that, and have a go at those two questions that I've put on at the side. So why did the Labour Party win the election, and why do you think people rushed to get new whole sets of teeth? So this one you need to think about. Why do you think people were doing that as soon as the NHS started? Have a think. What would you do that if that was you and you'd not had any healthcare? And why did they win the election? So you need to be looking a little bit here and think about, the impact of the war and how that would have had on people and those that were voting. So pause and have a go at those. So with the NHS, we've got this welfare state as well. So obviously the Labour government was elected in, and Clement Attlee, the new Prime Minister, said that he would set up this welfare state. So as we get the NHS, we've also got all these other benefits. So the poor are receiving financial help and benefits. The school leaving age is raised to 15 so that every child had a chance to get a decent education to help them progress in life. And the government's programme of slum clearance continued. So remember how last week I talked to you about homes built for heroes? There was lots more new homes built. Well, in this time, 12 new towns were created, and by 1948, there were 280,000 council homes being built. So there was lots of developments going on. And the NHS was such a huge success. For example, for women, their life expectancy improved. People now started to consult a doctor. For example, women were now 4 times more likely to consult a doctor than they would before, and it was huge, and people now go to the doctors very regularly. And also life expectancy for newborns had improved. But although this is being paid for by the government and through taxation, the upkeep of it and the amount of people, and obviously baby booms and the population growing, puts a huge strain on the NHS. And again, we're going to follow up on this a bit more next week, but because of this strain, doctors now started to need to charge for things like prescriptions or dental services. However, the NHS has always been very good at ensuring that no one is deprived of, essential services like family planning, childcare, cancer screening, asthma. And so although there are some things that we now have to pay for, they are really mindful of what they keep free and what they allow everyone to be able to access, which is great. And just to give you a bit of an idea, this is from the textbook that we usually use, just to show you what we get from this welfare state. So you can see on this picture all of the benefits that children get from the welfare states. We've got clinics, we've got cheap or free milk and foods, we've got cheap free school dinners, dental appointments, spectacles, education for free. Adults and their families can get free doctors. If they're unemployed, they can get some money, they get training. They get free hospitals, cheap medicines, family allowances, sick pay, maternity grants, and then, this idea from cradle with the baby clinics to grave with financial help from the funeral costs. So you might want to make a note of that, take a picture of that, or copy some of those out into your books. A few more questions then for you. So can you have a go at answering these questions using the knowledge from the previous slides, but also you might need to use some things from last week, thinking about the Beveridge report. So what were the aims of the NHS? To what extent was the NHS to what extent did the NHS provide free universal healthcare? So how far was it free? Did you have to pay for anything? And can you explain why the government was an important factor in the development of public health? And that can be throughout time, or you can just focus on the last sort of time from the Liberal reforms to the NHS. So have a go, pause in and have a go at those questions for me. Okay, so was everyone happy with the establishment of the NHS? Was everyone really buzzing and excited for it, or were there some opposition? And the answer is yes, unfortunately there was some opposition to the NHS. Whilst it was exciting and it was something new, the most important opposition actually came from doctors, because they were so worried about all the money that they were making from private healthcare that they were going to lose out on it. So Bevan had to work hard with the doctors and kind of come up with an agreement that they could still see their private patients in order to get extra money as well as a wage from the government for working for the NHS. Also, some still believe that the poor should not be helped because they thought that the poor would be lazy, and actually that they'd be more lazy if they thought they could get something for nothing. So they kind of was like, maybe this isn't great. And then finally we've got some local councils and charities that didn't actually want the government to take control of their hospitals. They'd worked really hard to develop them and to implement them, and they were kind of like a bit skeptical about the government nosing in, taking over what they'd worked so hard to achieve. So there was a fair bit of opposition, and it meant that Bevan had to work a lot harder. He had to really, you know, kind of talk about the benefits and make sure people were aware of what would come from it. And there were sources like this to show the opposition. Okay, so we've got Aneurin Bevan just here walking down the street, you know, with his briefcase saying health for all. He wants to help everyone. And we've got Harley Street, a really famous street for private healthcare, still famous today actually, if you might have heard it and come across it. So he's walking down the street, and then look, we've got the doctors here that have got all their equipment. They're probably private doctors who aren't particularly happy, and they're trying to trip up Aneurin Bevan as he walks up down, and they're like, here they come, boys. And it shows that they're not happy, they're not particularly supportive of Aneurin Bevan. They kind of want to trip him up. It's almost like they want him to fail because they are not keen on the NHS, they're not keen on having their wages drop, they're not keen on making less money, and all these different reasons that they kind of want him to fall on his face rather than this healthcare for all be a success. It's just sad, isn't it? And they're not the only ones. There are a few other different reactions. So I've got the source there, it's just a little bit smaller. And then we've got two extracts from the British Medical Journal, the official journal of the medical profession. And these people said, if the National Health Service is set up, then doctors will no longer be independent. They will instead be technicians controlled by the civil servants and by men and women entirely ignorant of medical matters. So they're talking about the government, okay? And it's kind of saying doctors will no longer be, they'll lose the independence that they've had so far, okay? And that kind of worried them a little bit and made them a bit sceptical. They also say, if the bill is passed, no patient or doctor will feel safe from interference by some government regulation, and the minister's spies will be everywhere. So spies everywhere, it's like they're being taken control of, and you know, that's what's worrying them. What I'd also like you to do is, below again on the comments section, I've put two more clips. There's one that's called Your Good Health, which is an advert that the government created about the NHS. I think it's really funny. I really like it. So please watch that. It's about 8 minutes long. And then a really short clip, which is about 2 minutes, from the BBC. I think it's BBC Bite Size, talking about the NHS and the beginnings of it. And what I'd like to do is watch those two clips, read through this source again, pick out things from this source again, and have a go at answering these two questions. Okay, so how did people react to the NHS? Why did they react like this? And summarise the reaction of the NHS in 80 to 100 words. Okay, so kind of summarise all of it. Try and refer to, if you can, these sources and the other source that we looked at as well. But how have people, what are the different reactions to the NHS? How are people kind of perceiving it? Some people are happy, some people are not. Why? And explain why they reacted like this. Why were people not happy? Why were some people happy? So think about the 8 million that have never seen a doctor before. They're obviously going to be quite overjoyed, but then think about all the doctors that are paying for it. And in Your Good Health, you kind of get an indicator about society, so kind of looking at the divide between the rich and the poor, because the rich kind of think, well, you know, everything's fine at the minute, we can afford our healthcare and we get healthcare and it's great, but what about the poor? Why is it showing sort of the big gap between the rich and the poor as well? Okay, so have a go at that for me. Okay, so hopefully that all makes sense with the creation of the NHS. I'll put a couple of bits on at Microsoft Teams as well, but like I've said, if there are any issues or any questions, just pop on Microsoft Teams or send me an email and let me know. Next week, we're going to kind of finish public health, by looking at the impact of the NHS over time, how the NHS has kind of turned a corner for people's health. We're going to look at 21st century medicine as well and look at how that's implemented, and kind of evaluate the significance of the NHS, because the NHS was important. It turned a corner for healthcare, and it also changed the population. I'm recording this on last week to you, 22nd of June, and actually this marks the anniversary of when the Windrush came to Britain, which is the big ship that brought over lots of people from the Caribbean to come and work in Britain, particularly bringing an awful lot of nurses for our new, well, about to be established NHS, because the NHS was then fully opened the next month in July, the 6th of July. So you know, it's really important because it changed an awful lot, and because, you know, the war obviously left us with lots of people had died. We needed to improve lots of systems like the healthcare, but we didn't have the manpower to do it, or women power as well, and so they needed help from its empire, who had fought so bravely along everyone's side in the war. So they said, come over and help us, and we've got lots of jobs to fulfill. And that's what happened. So we'll look at that in a bit more detail next week as well, to finish off, because next week will be the 5th week and the last week before the summer holidays, which is very strange. So just to finish off, let's have a go by answering these 5 questions from today. So pause in a second and have a go at answering and see how you do. So what year was the NHS introduced? Name 5 things that the NHS provided. Who were opposed to the creation of the NHS? Why did people believe the poor should not be helped? And until 1948, how many people had not seen a doctor because they couldn't afford to? Let's see how you did. So these are all in your fact book, so you can check them again there. So it was introduced in 1948, as I've just said. 5 things, I've put all of them down, so just pick 5. As long as you revise 5 of those, if you revise all of them, that's brilliant. But I know for question 2, there's an awful lot of facts here. So if you are struggling, you just need to know 5 of them. But obviously put all of them so you've got them there, but just try and remember 5. Who was opposed to the creation of the NHS? Predominantly it was the doctors. Why did people believe that the poor should not be helped? Because they thought they would grow lazy if they got something for nothing. And it was 8 million people who hadn't seen a doctor. Okay, so well done everyone. Apologies, I've run over again. Next week we'll go under 20. Hopefully you're all okay. Let me know if there's any problems, and hopefully see you soon. Take care. Bye.